Welcome to podcast number 27 in my series, Colonies to Colossus, The Rise of a Giant. In this podcast, we're going to be taking a look at medicines and medical treatments in the colonies. To help us have a better understanding of these treatments and medicines, I have a medical professional here with me today, Dr. Douglas Hobbs. Hello, Dr. Hobbs.
Hello.
I'm glad you could be here today. Dr. Hobbs, will you take a minute and just tell our audience some of your qualifications, training, and background, please?
Yeah, so I'm a local boy here in town. Did my undergraduate out at Brigham Young University and then went out to medical school in St. Louis. When I got done with medical school, I did an additional 3 years of postdoctorate training in emergency medicine in Albuquerque, New Mexico. Albuquerque was the only level 1 trauma center between Denver and Phoenix, and so we saw a lot of different kinds of trauma in addition to just your basic illness and injury. As an emergency medicine doctor, we do a little bit of everything. I might deliver a baby, or take care of a pneumonia, or set a broken arm, or take care of a gunshot wound. And so in some ways, we're like the simple country doctors that might have existed at colonial times. After I was done with my training in emergency medicine, I worked for years in the emergency department before a fellow ER doctor and I opened some urgent care centers where we continued to be a jack of all trades and do whatever came in the door.
Okay, a good place to start in understanding the underlying foundations of medicine during the colonial period is talk about a man named Galen. He was a Greek physician that lived in the 2nd century AD. He was the physician to a couple of Roman emperors, I believe. And I think it's with him that a lot of the ideas that doctors operated under during colonial times.
In the early days of medicine, one of the big challenges was that medicine was more of a religion than a science. There were different philosophies of the time, and Galen was a very popular philosopher. Galen shared some ideas that he felt like some of the diseases that affected the human body could be caused by an excess or lack of certain humors. Because of Galen's ideas, some of the things you've heard about in the past, like bleeding patients, came to be quite popular. They could feel like if a patient had a fever, he had too much blood. Galen got even more specific and felt like perhaps you had too much blood in a certain organ. For example, they sometimes bled you from your left hand if they wanted to reduce the volume of blood in your spleen, and they bled you from your right hand if they wanted to reduce the volume of blood in your liver. In point of fact, this doesn't make any difference which hand we take blood from. And in fact, letting blood out of people is no longer believed to be a way to improve their health. But at that time, with the lack of science that we tend to rely on today, a lot of ideas simply passed on almost like mythology. And doctors of that time often were fans of Galen and used many of his ideas, sometimes with some success and sometimes with terrible outcomes. I think a little later we may talk about how George Washington's doctors used some of Galen's ideas to kill him.
Now, just curious, in modern medical practice, would you ever bleed a patient under any circumstances?
We do, actually. Where I've seen it most commonly is when I worked in St. Louis, we had a lot of patients with sickle cell anemia. Sickle cell anemia patients have a disorder in their blood that causes the blood cells to turn into the shape of a banana rather than their normal donut shape. The banana-shaped blood cells often clot up and can wreck organs and can get caught in bones and cause a lot of pain. An easy way to treat this is to transfuse them with normal red blood cells. By giving them a lot of red blood cells, we dilute out the bad blood cells they have, and their sickle cell crisis is alleviated. The problem, though, is that when you give people a lot of transfusions, each transfusion has a lot of iron in it, about enough to make a nail. You can literally give these patients iron toxicity. So after we transfuse them and their crisis is over, we sometimes had to bleed them and remove some of the blood because we had literally given them too much. But normally, we don't bleed people.
All right, I want to talk first about what was in a doctor's bag back then. I've read in some of these books about some of the medicines where they thought were medicines that they kept in bags. I'm going to read a list off, and then you can comment on any of them. These included beetle's blood, fox lung, dried dolphin, snails, and the fat of roasted hedgehog. I'm not sure what they use that for. Are any of these used today, or are there extracts in these that might be used in medicine today?
We do in fact use beetle's blood still to this day. Primarily used by dermatologists, it is a treatment for warts, like plantar's warts. It causes blistering. It's a blistering agent. It was a blistering agent back then as well. They tended to think that this blistering cured some illnesses like malaria and smallpox. In fact, it probably made them worse. But today we do use it to remove warts from time to time. Someday they'll probably look back at us and laugh at us just like we laugh at them. The fox lung, dried dolphin, snails, and the fat of roasted hedgehog are ones I'm not familiar with.
Has there ever been any medical or scientific research that you know of to find out if they had anything in them that might be useful in medicine?
I am not aware of any use for any of these.
Okay, I've also got another list of medicines here and what they were used to treat. For example, saltpeter was used for measles, headaches, and sciatica. Any scientific verification there?
None. We don't use saltpeter anymore. There is a similar drug we use, but it actually causes headaches.
Okay, also lavender and gingerbread were used for memory loss. Is there anything to that?
I need some lavender and gingerbread, but no, my memory loss seems to be permanent, and I think that while gingerbread is tasty and lavender smells amazing, neither are used medicinally.
All right, here's a strange one. It talks about a wolfskin girdle, burned black cow dung, and frog liver administered 5 times daily to treat epilepsy. Now, anything there in modern science or medicine?
This is really interesting because things like epilepsy come and go. A person might have 5 seizures today and then go a month and not have another. So often it's difficult for us to tell if the medication we're administering to a patient is in fact helping them. I think that these kinds of medications came about from this exact issue where they might have exposed a patient to wolfskin girdle or burned cow dung or frog liver, and then for a month they didn't have any symptoms, and so they felt it must have helped, when in fact it probably didn't do anything at all.
Okay, here's an interesting one. One of the remedies for strangury, which I guess was a difficulty urinating and also spasms in the urethra and in the bladder, was a gel made of boiling pumpkin seeds. Is there any veracity to this? It sounds to me like they just got prostate enlargement, but what would that indicate in modern medical terms?
I'm not aware of pumpkin seeds being used in this way, although health food stores often sell a variety of things that may or may not have benefits that haven't been tested. It's interesting to note that the prostate grows our entire life. It's the only organ that never stops growing. If we get to be very old, our prostate generally gets to be too large. Makes it difficult to urinate for many older men. The inventor of the urinary catheter was Benjamin Franklin. They told Ben that he was just going to have to deal with the fact that it was hard to urinate, but he wasn't the kind of person to accept answers of that type, and so he invented the urinary catheter. It's very similar to the catheter we use today.
All right, here's another one. It was a mixture of breast milk with the blood from an amputated tomcat's ear was used to treat hysteria.
That sounds hysterical.
Any medical veracity to that at all that you know of?
Not that I'm aware of.
All right, I'd like to talk a little now about inoculation and smallpox and what that did to you and how they dealt with it.
What smallpox does to a person is horrifying. George Washington understood how horrifying it was. Smallpox killed 1 in 3 people who caught it the natural way. That is to say, they were exposed to someone who had smallpox. Once they caught smallpox, they would develop high fevers. Some would have seizures. Most would have vomiting and diarrhea. But the fatalities came because large pustular sores would develop all over a person's body. It was not uncommon for these sores to become so large that each sore connected to other sores until a person's body was encased in pus and was just one sore from head to toe. Much like a person who would be burned all over their entire body, these sores would weep fluid and pus, and the victims would die of dehydration and the loss of fluid. It was a terrible death, and George Washington had a respect for the horror that this disease was. When he was a young man of 19, he accompanied his brother Lawrence to Barbados because Lawrence had tuberculosis, and they had high hopes that the good weather on the islands would be beneficial to him. While George Washington was there, he personally contracted a mild case of smallpox. He was in bed for over a month. He had terrible sores that left him with some lifelong scarring. He had felt what smallpox did, and he had seen what it did to others. He respected how quickly it could be shared from one person to another, particularly in places where people lived close together, such as the conditions in which the members of the Continental Army were serving. George Washington was looking for a way to protect his troops. At this time, there was no such thing as vaccines. His options were to quarantine his troops, which would make them unavailable for battle, or allow everyone to get sick, recognizing that 1/3 of his men would die. Or he could try an experimental therapy called inoculation. Inoculation was more gruesome than it sounds. They basically took a knife or a scalpel and made an incision, typically on the left hand of a soldier. Into this wound, they put pus from an infected individual. Sometimes they would take a thread and dip it in pus of an infected individual and then put that thread into the wound. These wounds were expected to become infected with smallpox. But the case of smallpox that would develop was much more mild than the cases that develop naturally. That is not to say that they were mild. After inoculation, men were typically laid up for a month in bed with fevers, nausea, vomiting, and some of these pustules. About 5 to 10% of men who were treated with inoculation would die. That number is far less than the third that died if they contracted a disease naturally, but imagine the weight this would place on the conscience of a kind person like George Washington as he attended funeral after funeral for men who died from their inoculations. This experimental medical technique was so controversial that it had been banned by the Continental Congress. George Washington decided that it had to be done. He sent a letter to John Hancock and said, "The smallpox has made such head in every quarter that I find it impossible to keep it from spreading through the whole army in the natural way. I have therefore determined not only to inoculate all the troops now here that have not had it, but shall order Dr. Shippen to inoculate the recruits as fast as they come into Philadelphia." This was an enormous risk. It was a very controversial procedure. In addition to the risk of death that people undertook when they received the inoculation, Washington also risked having his entire army out of commission for 30 days. Had the British learned that all of the American soldiers had been inoculated, it would have been a perfect time to strike at him while they were defenseless and weak.
That smallpox sounds pretty hideous, and the inoculation doesn't sound too fun either. I don't like the odds either way, but I guess it did give some immunity to have inoculation. I'd like to talk a little bit more about some general health issues and things that came up in the military. And the first one I'd like to start with is military discipline. I read in some of the books that some of these men, after they were lashed, it was specified that they be well salted afterwards. And I've heard different explanations of this, that it was maybe to try and help keep bacteria down or infections, that the salt has some antibacterial properties.
Salt does have some antibacterial properties, but it also destroys the tissues that it gets on because it's very drying, and it causes a great deal of pain. I tried to understand if this was to prevent infection or just to add to the torture, and it seems like it was most likely to just add to the pain of the victim of the lashing.
One of the other punishments that you read about occasionally is some men who did really egregious things could be sentenced to 500 lashes. And these lashes, if you were in the Navy, you were usually put upon a rowboat, and the lashes were divided out among each ship in the fleet. They would row you about and administer some of the lashes among each boat so that each Navy crewman got to see what happened if they did that crime. And if you were in the Army, they would tie you to the back of a wagon, and the drummers would administer like 100 lashes each weekend. They would do that over the course of a month or however long. Frequently you hear that a 500 lash sentence was a death sentence. I was wondering if you could give us some medical insights into how that worked.
500 lashes is hard to imagine. Fortunately, I've never seen this wound, but it sounds horrific. The lashes would tear skin and cause a substantial amount of skin damage on the back. You're looking at about 18% of the body surface area of a person. Our skin's job is to keep our fluids inside of us. When that much skin is damaged, we just weep fluid out the injured skin, and we leak and leak. This is what kills burn victims, is they just leak themselves to death. They can't hold their fluids inside. Since 100 lashes administered on one weekend would be followed by another 100 the following weekend, the wounds would never have time to heal in between, and they would be literally injuring previously injured skin. Death would come when people would lose so much fluid from their injured skin on their back that they would die of hypovolemia, or their wounds would become infected. And in the age before antibiotics, almost all skin infections were a death sentence.
I was wondering, too, if you could talk about some of the damage that cannonballs might cause during battle. It's kind of obvious what they would do, but maybe you could give us a little more insight into what a cannonball does to a body.
Cannonballs are particularly terrifying because they are so massive. If you picture throwing a baseball at my car, I end up with a dent, maybe even a broken window. If you picture hitting my car with a train, my car is gone. It just explodes when the train hits it. The cannonball conveys so much energy compared to a normal bullet because of its size. A cannonball would have 516 times as much mass as a 50 caliber bullet. When it hits a person, it basically just makes them blow up. If a cannonball hits a limb, it would be basically an amputation. It would just tear that limb off the body. Also, in the age before antibiotics, anytime you broke a bone and it was exposed to an open wound, it would become infected, and what you really got was a lingering death.
Another thing I was kind of curious about was what happened with these musket ball wounds. And not only musket balls, but sometimes cannons could be loaded with what was called grape shot. It would fire out like a big giant shotgun. What did musket balls do, especially if they hit a bone or a nerve or a blood vessel?
Musket balls were also terrifying, especially if they hit a bone. As I'd said before, any kind of open wound that communicated with a bone fracture was basically a death sentence. In this time period, the only way to avoid death in these wounds was to amputate the injured limb. This resulted in a lot of battlefield amputations. Anesthesia was basically enough people to hold you down and something to bite on, so battlefield amputations were a terrifying specter. I have dealt with a lot of bullet wounds as an ER doctor from modern weapons. When a bullet goes through a person, it leaves a shock wave behind that does as much damage or more damage than the bullet. The shock wave can explode solid organs like, say, your kidney or your liver that might not even be directly struck by the bullet. Some of these musket balls could achieve velocities up to 1,500 feet per second. To put that into perspective, that's about twice the speed of sound, and that's approaching the kind of velocities you could expect from many modern firearms, and it does a substantial amount of damage even at some distance from the hole that's torn through a person. When a person dies of a gunshot wound, what they really die of is the loss of blood. Your heart is just a pump. It pumps blood to your brain. Our brain uses 40% of the oxygen in our body. If you can't pump enough blood to your brain, you die, and that is how death is achieved when you shoot someone.
The other combat injury I wanted to ask about had to do with bayonet wounds. You hear of people being stabbed repeatedly and yet surviving or lingering for a few days. Is it in any way comparable to a modern knife wound? And just to kind of let our listeners know, British soldiers were usually taught to thrust the bayonet in and then twist and then withdraw it to cause more damage.
Much like real estate, bayonet wounds are all about location, location, location. If you are stabbed in the right spot, or perhaps I should say the wrong spot, you're done. However, many stab wounds don't hit vital organs, and many patients survive. In my experience in the ER, most of our patients who are stabbed in the abdomen survive. Lots of internal organs can kind of glide out of the way, like your intestines, and a puncture wound might go through the abdominal wall and then push the intestines out of the way and cause limited damage inside. A bullet, on the other hand, rips through a person so quickly that it tends to puncture holes through the intestines on its way through, and that leaves the patient full of feces. And this is a terrible way to die. Feces is full of bacteria, and the risk of death after you have spread bacteria through the patient is immense.
One of the kind of injuries that some of the men got on ships were when cannonballs came crashing through the hull of the ship, sending a shower of splinters into the men. Is there any way to treat that, or is that just an automatic infection and death?
Unfortunately, at that time, there would be very limited options for treatment. Today, we have modern antibiotics, which help us treat some infections, but a person who was showered with foreign body, this could be stuff like parts of the ship that were ripped off by a cannonball and flung into a sailor, could create wounds that would be covered in bacteria, and frankly, you would probably be fortunate to be struck directly by the cannonball and die instantly, rather than to be struck by debris that exploded off of the ship and die a lingering death.
I was hoping you could mention a little bit about scurvy and how it was prevented on board Navy ships.
I've never actually taken care of a single case of scurvy because, thank heavens, vitamin C is so easy to get. However, the British sailors were often referred to as limeys because they had the habit of taking limes on their ships to have the vitamin C available to their sailors. If you got scurvy from a lack of vitamin C, you'd develop sores all over your skin, you'd get bleeding gums, you'd lose your teeth, and it could weaken your bones. However, it's easily preventable, and so in modern times, I have never actually seen a case. It's so easy to get vitamin C to most of our people.
One last topic dealing with military issues has to do with sanitation in the camps. I know we've all heard the stories about General von Steuben, sometimes called von Steuben, cleaning up the camp, having them remove dead carcasses, and latrine placement.
Infection killed 90% of the soldiers that died in the Continental Army. You only had a 1 in 10 chance of being killed by a bullet versus being killed by an infection. Von Steuben was very aware that if you put your latrine too close to camp, you were going to kill soldiers, and it wasn't going to be a pleasant death. These were men that might literally poop themselves to death. The placement of a latrine seems like a very inconsequential matter when you're thinking about war, but in fact, von Steuben saved many, many, many lives by teaching the Continental soldiers how to place their camp cooks far from their camp latrines.
I just wanted to ask you a couple of questions about general health issues. For example, the first one is the use of snuff. We hear about these guys using snuff. It was made of kind of grinding up tobacco with other things to give it a flavor or a special scent. Did that have any effect on people's health?
It seemed to have some of the same effects that tobacco used orally does. The CDC lists it the same as chewing tobacco as far as its tobacco risk for causing cancer. Tended to increase their risk of nasal cancers. Issues with it would be that they probably got a little buzz because it does give you kind of a quick shot of nicotine. And they probably put some scented items in it, it sounds like, that may have been pleasant because it sounds to me like the old times often didn't smell pleasant. So they probably liked the snuff just to get the rancid smells out of their nose.
Another issue I read a lot about has to do with the dangers of childbirth and the risks to mothers back then and how much they went through just to have children. Do you have any statistics or insight into what happened back then?
Childbirth was a really big deal. The risk at childbirth was about 1.5% mortality per childbirth. So you're looking, it doesn't sound like a lot. You think, well, that gives me 98.5% chance of surviving a pregnancy. But if a person had 10 pregnancies in their lifetime, now you're starting to look at a relatively high chance of them dying in childbirth. About 1 in 8 women died in childbirth. When you think about that, think about, do you know 8 women? Do you know 16? Do you know 80? If you know 80 women, then there's a pretty good chance that 10 of those women would have died during childbirth. That means you're talking about women that die in the prime of their life. The childbirth ages is not people who've died of old age, but they're young 20-somethings who die in childbirth. That's a lot of 20-year-old funerals to attend. The risk of childbirth was significant. The risk came from a number of issues. They didn't have cesarean sections to take out difficult deliveries. They sometimes had issues with the placenta being in a complicated position that can be dealt with surgically today, but they didn't have that kind of availability then. They couldn't do blood transfusions, and so blood loss associated with pregnancy was not uncommon and could lead to death. And infections were relatively common and almost impossible to treat. They needed to be treated by avoidance. One of the interesting medical heroes of mine was a guy named Ignaz Semmelweis. Ignaz was born in 1818, so he was a little after George Washington's time, but in that similar time period. He was a Hungarian doctor, and his specialty was OBGYN. In his hospital, he ran some statistics to see what your chances were of dying of postpartum fever. They called it fever after childbirth, and realized that if a doctor was who took care of you during your childbirth, you had 5 times the chance of dying of postpartum fever than if you were taken care of by a midwife. This didn't make any sense to him. He thought the doctors had more training and they had more expertise. He didn't understand why the death rate was higher for the doctors, and he began to research a number of issues. What he ended up settling on was that one of the differences between the midwives and the doctors was the doctors did a lot of autopsies and they did a lot of dissections of the recently dead to learn anatomy, and that when they were coming from their dissections and going to deliver these newborn babies, they were not doing anything in between. And he came up with the idea that there's something on the dead that can be carried to the living on the hands of the doctor. Nobody had microscopes back then. They didn't know what a bacteria looked like, and they didn't know what a bacteria or virus was. But he had the idea that there's something on us that we take from our sick patients to our well patients, and they become sick also. He instituted the practice of washing with chlorine in between patients and in between doing anything with the dead. And the risk of dying by having your baby delivered by the doctor dropped down to 1%. This was a massive, massive change. You would think the other doctors would have been really grateful, but in fact they hated Ignaz because they felt like he was blaming them for the deaths of these babies, saying that there was something about them that was dirty or unclean, and they felt offended by it. Ignaz ended up getting committed to an insane asylum when he was 46 years old and died 14 days later, probably beaten to death by his guards. Ignaz probably did have some insanity, and it probably came from syphilis, which was an occupational hazard for OBGYNs at that time period. He delivered babies for anybody, and some of those people may have had STDs, and the lack of protective equipment was profound and went both ways. Patients were in danger of getting infections from the doctors, and doctors were in danger of getting infections from the patients. So it's an interesting history. Today we take for granted that childbirth is relatively safe, whereas at one time there was probably a 1 in 8 chance that a woman would die related to childbirth.
One of the diseases we hear a lot about people having back then was gout. What exactly is it, and how is it treated today, and is it very painful?
Wow, gout is an exquisitely painful disease. Fortunately, I've never had it personally, but I've taken care of grown men who were in tears from the pressure of a bedsheet on a gouted toe. I've had grown men ask me to not walk so loudly as I entered their room, and I'm a $150 soaking wet, and so I'm not really the kind of person who generally shakes the floor. It seems like a very painful disease. It's caused by uric acid, and the uric acid can come out into the joints and form crystals. The crystals in the joints are very sharp and exquisitely painful. Joint gets red hot and outrageously painful. Uric acid can come from eating too much uric acid or because your body doesn't get rid of uric acid fast enough. If you don't pick your parents just right, you might inherit kidneys that get rid of uric acid a little bit slowly. If that's the case, you might never know. But if you happen to be someone who likes foods that have a lot of uric acid in them, and those foods tend to be foods we associate with wealth, especially back in that time period, you're talking about aged cheeses, fine wines, organ meats and caviar, foods that had a lot of uric acid in them. And so the wealthy seemed to be afflicted by gout more than the non-wealthy. And that was probably a true observation. And it sounds like a terrible disease. Today we typically treat it with a medication called colchicine, and it works quickly, like same day. I can usually get somebody pain-free on their gout. But in the old days, some suicides were attributed to gout.
One last disease I wanted to ask you about was rheumatism. What was that, and how do you deal with it?
We still kind of have rheumatism today. I sometimes refer to it at my house as the high price of fun. If we do enough stuff, we get some aches and pains. And my old body doesn't tend to heal up as quick as my young body used to. And we've all got achy knees and achy joints. But I can just pop a few Motrin and be on my way. But they didn't even have so much as a Motrin back in the time of George Washington. In addition to that, rheumatism kind of included people who might have had other diseases like rheumatoid arthritis, which can cause disfiguring or crippling pain. And they didn't have anything to treat it with. And frankly, even in 2020, we struggle to manage rheumatoid arthritis and some of the diseases like it because they're complex and difficult to manage.
Okay, for our last segment, I wanted to talk a little bit about some of the health issues and treatments that George Washington endured to work on his health. And the first one I want to start with was he had a surgery on his leg shortly after he became president. He had a tumor that was taken out. And I know also John Adams' daughter had a breast remove, and it kind of makes me think about what surgery was like back then without anesthesia or many of the other things today that we just take for granted that make surgeries relatively easy.
I'm going to confess right up front that I'm a crier and a bleeder. My dentist will tell you that it's a good thing I'm alive in 2020 because I need all the anesthesia. Surgeries in the olden days were often prized to have a surgeon who could work quickly. Now we really prize it if your surgeon does great work, but they considered great work to be you did surgery fast. When you're talking about having a tumor cut out of your leg and the anesthesia is going to be that you get to bite on something, they like to have you get done quickly. And so good surgeons were generally actually fast surgeons, someone who was quick with a knife. John Adams' daughter having a breast removed for cancer. Cancer remains a huge issue in medicine today. Even in 2020, we struggle with many cancers, but one of the little advantages we have is that you can be asleep while we remove your cancer. Being awake, extremely, extremely awake, is a terrible way to be while some portion of your body is removed. Breast cancer could be cured by removal of the breast. But removal of the breast was an extremely painful process, and they tried to do it as quickly as possible to minimize the pain, but it was painful, outrageously painful. From examining old Egyptian mummies, we can see where they had done cancer surgeries back as far as the Egyptian pharaohs. And while they may have had some success with tumor removal, we hope that they had something better to offer for pain relief than what the colonial founding fathers had. And well, I'm sure that having the tumor removed from George Washington's leg was extremely painful. I bet John Adams found it even more painful to have his daughter's breast removed, knowing that she was going to go through that kind of pain.
A lot gets said about George Washington's teeth and this kind of thing. I know he had false teeth made out of, I think it was walrus tusk bone and some other things. But one of the things he tried to do to save them was he put tincture of myrrh on them. Does that have any medical value at all?
I'm not really very familiar with tincture of myrrh, and that's not one that we use any longer. The question of George Washington's teeth is a fascinating question. He lost all of his teeth before he was 30 years old, which was unusual even for his time. Sometimes we think that perhaps they didn't take good care of their teeth, but George Washington was meticulous in his care of his teeth. It seems likely that his teeth were very, very damaged by mercury. When he was 19 years old, he suffered from smallpox. They treated him with calomel, which was a mercury-containing medication that, per Galen's idea, was a purgative. Basically, it gave you vicious diarrhea. They felt that you could get the smallpox out of your body by pooping it out. Turns out it just gives you vicious diarrhea and you have smallpox, and in addition to this, it poisons your teeth. It can cause jaw necrosis, and it causes necrotic sores inside people's mouths. Some of these sores would become so large that they would go all the way through and you could see into a person's mouth. And so calomel had a lot of terrible side effects. Unfortunately, at that time, many doctors were in the habit of doing things that their predecessors had done, even if they had not been shown to be useful. Medicine was in large part a religion more than a science. It was starting to embrace science, but many things were just done because they had always been done that way, and unfortunately George Washington suffered from a number of these.
The last thing I want to mention about Washington was his being bled. Back then, I know that sometimes they would do things like bleedings. They would also do blisterings. I know King George III had that done to him as a way of getting rid of the ill humors in the body and so forth, following Galen's ideas about balance and the ill humors. Could you give us some idea of what would happen if you were bled as many times as George Washington was just before he died?
The idea of removing ill humors from the body by bleeding is a very old idea, and as you said, Galen probably popularized it. The challenge here is that at this time of George Washington's life, they did not seem to have a good understanding of how much blood was in a human body. They felt like a human held about 5 gallons of blood. The truth is we hold about half that much. That's still a lot of blood. If you've ever seen it spread out, it looks like quite a mess. But we don't have enough to just keep taking it out, and doing so doesn't remove anything bad from us. George Washington had a terrible sore throat before he died. He had a lot of swelling and couldn't swallow. It's unknown what he had, most likely a strep throat. Could have had mononucleosis or other things that cause swelling in the throat. He was miserable. His doctors wanted to help him. Unfortunately, they didn't know how. So they took 10 ounces of blood from him. That was a normal bloodletting. They waited to see if he felt better, but poor President Washington still felt miserable. So they decided they needed to take 24 ounces more blood from him. They took another 24 ounces of blood from him, and he still felt horrible. Now he felt weak, in addition to having a swollen and painful throat and being unable to swallow. Another doctor was called who felt that they needed more bloodletting, and so they took an additional 32 ounces of blood from him. At this point, they will have basically removed 1/3 of George Washington's blood. That is about how much you can remove from a person before you kill them. Given his age and the fact that he was already sick, he died that day, which is not unexpected if you remove 1/3 of a person's blood. Unfortunately, at the time, this was considered to be state-of-the-art medical care. I hope that someday in the future they look back on the medical care we provide today and they mock us just as hard, because that would mean that we have much better techniques than we have today. Some of the things we do today strike even me as barbaric, but the things they did to some of our great American heroes about make me cry. I think George Washington probably succumbed to the therapies administered by his doctors.